Does your skin feel like it's going to rip open after a cut or a surgical incision? Maybe you are trying to work on your finger or thumb range of motion after a surgery or maybe a hand injury, but the skin and scar tension and pain is preventing you from making any improvements, or maybe worse, it's making you more stiff. Well, you are not alone. Hey guys, I'm Michelle from Virtual Hand Care, and I recently received a comment on one of my YouTube videos by a subscriber. Andrea V says, I can barely move my finger after 6 weeks of healing from a severe cut, having some trouble as the skin healed tight over the last joint. So when doing the stretches, the skin feels like it's about to rip open. If you're experiencing that too, then stick around, because in this video, I'm sharing 3 treatments for tight scar tissue so you can work towards pain-free range of motion. But first, let me preface by saying that cuts, incisions, wounds all heal differently. There are many factors that contribute towards proper healing. So always make sure you ask your doctor or your therapist when the time is right for you to start any type of scar management and exercises. The first treatment for tight scar tissue that may be limiting your range of motion is skin gliding or skin lifting. One of the main reasons why you might feel like your skin is going to rip open is because scar tissue is constantly tightening and shrinking. And as it tightens, it pulls your skin with it. This can be especially troublesome if the scar is over a joint crease or on the back of the hand where there's extra skin to accommodate all that flexion motion that we need. Just look at all the wrinkles that you have. You need this extra skin so you can bend and flex. Well, when you have a scar, that limits the flexibility of your skin, causing pain and tightness. So one way to help that is with skin gliding. Basically, what you do is you want to push or pull the skin from above or below a joint if possible. So if you have a cut on your PIP joint and the scar is really tight, you can push the skin to try to make a few wrinkles. It's sort of like taking the skin from somewhere else. Then ideally what you want to do is actively move while you glide the skin to try to get more range of motion of that joint. Another similar technique that can help is skin lifting. By lifting the skin, you are freeing up the structures underneath so they can glide without restriction. To do this, you can apply a small piece of kinesiology tape over the scar, but if your scar is really sensitive, you can even apply the tape around the incision to reduce skin tension. Now you always want to start with a light stretch to the tape of about 15 to 20% and then gradually increase to about 50%. The more you stretch the tape, the more it will lift the skin, but be careful of that because more is not always better, especially if you have fragile or sensitive skin. And never stretch the tape all the way around your finger or your thumb either. You don't want to compromise circulation. And since kinesiology tape is waterproof, you can leave it on all day so that it continues to help lift your skin even while you're doing all of your daily activities. And the second treatment for tight scar tissue that could be limiting your range of motion is short arc motion. By this, I mean moving in smaller ranges of motion that increase over time and comfort, each movement building on itself, which eventually turns into full range of motion. Scar tissue is tightening 24/7 and it does not take any time off. So it can be really painful to try to achieve that full range of motion, that full extension or that full flexion right after an injury, but also, especially first thing in the morning after several hours of not moving, as that scar tissue has been working for many hours, tightening up. However, short arcs of motion can be more comfortable and allow you to move without that feeling like your skin is gonna rip open. But with this technique, it is necessary to do the smaller movements as often as possible. We're talking like 4 to 5 times a day. And with the intention of increasing your range of motion over time. One way I like to track this is by drawing an outline of your finger. So for example, say you have a scar on your PIP joint and you are trying to get more flexion, but your skin is just so tight. Place your finger on the side of a piece of paper, but bend only to discomfort, not to that painful feeling like your skin is gonna rip open. Draw an outline of your finger in that position, then move to this line in short arcs of motion for about 5 to 10 repetitions until it feels more comfortable for you. Then try a few repetitions a little bit beyond that point, and then draw another line. And continue to do about 10 to 20 repetitions of those 4 to 5 times a day, with the goal of going a little farther and farther, drawing a new line each time. You'll have something to work towards, but you'll also be able to see how far you've come. And finally, the third treatment for tight scar tissue that could be limiting your range of motion is low load, long duration stretching techniques. This involves a constant low intensity stretch that is applied to your scar tissue over a longer length of time. We're talking like 30 minutes, an hour, sometimes even several hours, such as when you're sleeping. This is typically done with a splint, with a strap, with an ACE wrap, or a static progressive device. Scar tissue is a bit like concrete. Eventually, it can become hard as a rock, but in the early stages, it can be changed and moved. And in the case of scar tissue, it can be elongated over time. So this technique can be a game changer for thicker scars that are starting to cause contracture formation and severe joint deformities. This basically means all those deep soft tissue structures like the joint capsule, ligaments, muscles, tendons, and fascia are getting very tight and limiting your range of motion. So while using a low load, long duration stretch can take a lot of time out of your day, it's often necessary and you get better results to short duration, more aggressive stretches that only cause more pain, more swelling, and often make you more stiff. It's a vicious cycle to be in. So instead, try low load, long duration stretching in flexion or extension, whichever position you need for 30 minutes, 45 minutes, an hour, for about 2 to 3 times a day to allow your skin and your scar to elongate over time. So for example, if you have a palmar scar that is preventing you from getting full extension, then you may need to apply a low load, long duration stretch with an extension splint. Or if you have a scar on the back of your finger and it's preventing you from getting flexion, you may benefit from an ACE wrap or a device that stretches your scar in a flexed position. And because this method requires you to stretch for such a long length of time, it is necessary to maintain a low level stretch that keeps your pain minimal. That way, as your tissue stretches out comfortably over time, you can adjust the load or the force to continue to make improvements. Now, you may have noticed I never once in this video talked about scar massage or silicone gel pads as scar treatments. While those can be helpful, they don't get you moving unless you are using them in conjunction with active and passive exercises to improve your range of motion. Now, if you found this video helpful, do please give it a like and don't forget to hit that subscribe button below. Now, if you are struggling with a hypersensitive scar, then check out my video, how to desensitize your finger scar, or learn about what I did for my scar after my shoulder lipoma surgery, and I'll link both of those here. Until next time, thanks for watching.